Ready? Our next topic is reflexes. So what's a reflex? Well, it's an involuntary reaction to a stimulus. It happens almost instantaneously, and we don't think about it. But we do feel it, and we do know that it happened later, so that means the signal does eventually get to our brain, but something happens first, okay? So how does a reflex work? Well, it works like many of those diagrams I already showed you. So let's look at this one. We have a stimulus, so we have some receptors. This is going on a sensory neuron. This would be an afferent neuron, and then going to the spinal cord, this being an interneuron right here, and then coming out on a motor neuron, an afferent neuron, to a muscle, and then the response is that we move away. But you can see, I mentioned this in another one before, you can see that signal is also going to the brain. So it's not like the brain is skipped. It just doesn't go to the brain first. So it's like, oh my goodness, quick respond, but then our brain is still involved in the process and still given a chance to be able to interpret that information. So this is called a reflex arc. Let's look at it again. So we have a stimulus, so we have a receptor, a sensory neuron, that spinal response, that interneuron. Remember, motor neurons are efferent, sensory neurons are afferent, okay? And so then our motor neuron is going to have our effector, our response, but the brain is still involved, okay? Signals still do get to the brain, okay? It's just that in a reflex arc, the response does not need the brain. The response is just sensory neuron, interneuron, motor neuron, bam, respond. That's it. So you probably already know this one reflex. It's the patellar reflex, that knee-jerk reflex. And why do we have this reflex? So it's not so doctors can hit us with hammers and test our reflexes. That's literally not why we have the reflex. Why do we have it? Because when the doctor takes that little hammer and hits underneath your knee, what they're doing is stretching that patellar tendon. Okay? When that patellar tendon is stretched, what it's indicating is that we need to contract that muscle to help keep our balance. So the quadricep muscle contracts to help us keep our balance. So it's assuming that you are standing and that tendon is stretching, and so to keep our balance, we should straighten our leg. So that's why that reflex exists. It's not so we can test it. So let's look at some newborn reflexes. So we have the moro reflex or the startle reflex. And what it is, it's a quick abduction and then adduction of the arms, a startled look, often a cry. And swaddling can help stop this reflex from happening, or at least control it, so that a newborn doesn't wake themselves up, because literally their arms will just do this and they will often wake themselves up. So swaddling does have a purpose. It's not just to like make babies look all cute and snug. So you can see here the moro reflex, the startle reflex, and you can see this little baby here sleeping, having that reflex. Nothing is happening, okay? But again, swaddling would help, would keep those arms like this so that reflex is controlled, okay? We have the rooting reflex, and that involves rotating the neck. So when the cheek is stroked, the baby will rotate the neck and open its mouth. So that's obviously to help with feeding. So what happens with rooting is stroking of the cheek causes the baby to turn its head toward the cheek that was stroked and then open its mouth. So turn its head toward the cheek that was stroked and open its mouth. This works in conjunction with the sucking reflex, and that means when something is placed that touches the roof of the mouth, the baby will start sucking. And this develops in utero by around 32 to 36 weeks, which is why babies born premature may have issues with feeding because that sucking reflex has not fully developed. So again, something that is placed on the roof of the mouth will stimulate that sucking reflex. It works in conjunction with that rooting reflex. All right, then there's the stepping reflex, where a very young baby, when you place their feet, the soles of their feet, flat on the surface, the baby will move its legs like it's walking. This disappears around 3 to 4 months, but it comes back again around 12 months as babies learn to walk. So the stepping reflex, obviously without support, these babies clearly cannot walk. They do not have control of all those other muscles, but the reflex is still there. They will still move their feet as if they're attempting to walk. We have palmar grasp. So palmar, think palm. If you stroke the palm, it causes the baby to grasp. So palmar reflex, the palmar grasp reflex, stroking the palm causes the baby's hand to grasp. Now it can kind of feel like this intense death grip, but it is just a reflex and it's not predictable. So you shouldn't try to rub the palms of both babies' hands and then attempt to have the baby hold itself up like a pull-up, because the baby will let go at whatever randomly. And it's not like they're consciously choosing to hold on. It's a reflex. And then we have plantar grasp reflex. Okay, so that's the sole of the foot. So stroking the sole of the foot is going to also cause the baby to grasp. So pressing on that sole of the foot and the baby will grasp. This lasts a little longer until around 9 to 12 months or so. Then we have the tonic neck reflex or fencing reflex. So that means when the baby's head is turned to one side, that arm, so if I'm turned this way, that arm is straight out and this arm is bent, flexed. So you can see whichever way it's pointing. The reason it's called fencing is like, imagine you are going to fight someone with a sword and you're looking at them. The hand that is looking the way you're looking, that one has the sword and it's pointed at them. The other one is bent and ready. Okay, so the way you're looking, that arm is straight out, indicating kind of like the sword. Now, there are some reflexes that are tested in neurological exams. And abnormal findings can indicate some problems with your nervous system. So let's just cover a few of them. Okay, so we have the Hoffman sign or Hoffman reflex. All right, so how do you do it? So you take the middle finger, okay, or you could do it on the ring finger, but most of the information you'll find is about the ring finger. And what you're going to do is just flick the nail of the middle finger, okay? Now, what is a normal response? Literally nothing happens. Boring, okay? But if it's an abnormal sign, what happens is as you flick this nail right here, these fingers, just the finger or the thumb, may flex toward each other. And you could see that happening in these GIFs here. So what can this indicate if it happens? So again, nothing is supposed to happen. But if you have some flexion in your index finger or in your thumb, it can indicate multiple sclerosis or perhaps a brain tumor or perhaps a spinal cord injury. Those are just some of the possibilities. Okay, Babinski sign or a Babinski reflex. So normally with an adult, when you stroke the sole of the foot, the toes are going to curl down. The Babinski sign or Babinski reflex, if it's abnormal, means you stroke the foot and the toes curl out and fan out, okay? Now, this can indicate things like stroke, brain tumor, meningitis, spinal cord injury. Those are some options. What's important to note about this reflex is that up until about 1 year of age, the toes do in fact curl up and fan out, and that's normal. So it's like that reflex coming back, that sign coming back, that indicates a problem. So up until about 1 year, that is normal, but if this happens as an adult, that is an abnormal sign. All right, the snout reflex here. So what happens is you have your lips together, and above the lip right here is pressed. What's normal? Nothing. Nothing should happen. What's abnormal is your lips pucker. It can indicate some frontal lobe damage, like maybe from a trauma or a stroke. Now, again, interesting thing about this reflex is up until about 6 months, the lips will pucker. So when this is pressed in a young child, a young baby, those lips do pucker. That's the snout reflex. Normal in an adult is nothing, okay? In fact, until around over 6 months, nothing should happen. If the lips do pucker in someone much older than 6 months, that can indicate some frontal lobe damage. Okay, next is Myerson signs, or the glabellar reflex. So here, fun fact, there's an area of your forehead that is superior to where the bridge of your nose is, and it is medial to your eyebrow. So right here, this area is called the glabella. Who knew? Anyway, what happens with this sign is you press the glabella, tap the glabella. Okay. What should happen in a normal adult, normal anyone? Literally nothing. Now, you may blink once or twice because your body's like, what the heck? But that's about it. If it's called Myerson sign, that means that the blinking persists. So beyond that 1 or 2 blinks where your body's like, what the heck? But then realizes, oh, you're just tapping there. Whatever, no big deal. But in Myerson sign, the blinking persists. This can indicate Parkinson's disease. All right, now we have the palmomental reflex. Palmomental. So what that means is normally if I stroke this area right here of your palm, nothing should happen. In an abnormal adult, the chin is going to quiver, the mentalis muscle. So this can indicate Alzheimer's disease. Okay, so we're going to stroke this area here. Okay, normally nothing should happen to my chin. As a possible indication of Alzheimer's disease, as the palm is stroked this way, there could be quivering in the chin. Now, also with this reflex, sometimes it's seen at birth in children who have Down syndrome. All right, the Cremasteric reflex. So what is this? Well, in a normal adult, when there is like a brushing on the inner thigh, okay, the cremaster muscle contracts and the testicle elevates. So one of the testes elevates, depending which side you're using. In an abnormal adult, like nothing happens. So that inner thigh is stroked and legitimately nothing happens. Why might that happen? Well, it could indicate testicular torsion. So you can see the twisting, which would inhibit the elevation of the testes, or it could indicate nervous system damage. That signal's not getting where it needs to and then interpreted correctly, and then the signal sent out. So it could be a nervous system issue or it could be testicular torsion. Either way, it's something that should be checked out. And there you have it. That's reflexes. I hope you learned something new today.